The whole truth must now come out, says the Health Secretary, after a culture was allowed to develop in the NHS where defensiveness and secrecy were put ahead of patient safety and care. That culture, according to today's report, may even have included the Care Quality Commission, the regulator, the health regulator, deliberately covering up its own failure to investigate a cluster of deaths in a maternity department. Today, the head of the Watchdog said the report draws a line in the sand for the organisation. But does it? Here's our North of England correspondent, Kieran Jenkins.
Joshua Titcombe died just 9 days old. He was failed twice, his father says, by the hospital who failed to treat him and the regulator who repeatedly failed to investigate his death.
The fact that a child can die in those circumstances and that doesn't warrant a proper, honest, unambiguous investigation to determine what went wrong and to trigger learning from that is something that, is hard to imagine for me.
Joshua was among 8 babies and 2 mothers thought to have died from neglect at Morecambe Bay Hospital Trust since 2008. Today, a damning report reveals that all the while, the NHS regulator stood by. The Care Quality Commission has now been exposed, not only for failing to intervene here, but for declaring this hospital safe, despite knowing of major concerns. And having failed in its responsibilities, this report finds evidence it deliberately covered up its mistakes. The regulator's many shortcomings over Morecambe Bay had been catalogued in a powerful internal review, but its author says he was ordered to delete it in a meeting last year with 3 senior managers. One manager, referred to as Mr. F, is reported to have said, "Are you kidding me? This can never be in a public domain, nor subject to a freedom of information request." Another, Mr. E, is said to have expressed concern that the report could not be let into the public domain. The damning conclusion of the independent review is that this could properly be characterised as a cover-up.
No recollection of such a conversation occurring. This statement is at odds with the Ombudsman.
James Titcombe wants those responsible held to account, but the regulator won't say who they are for fear of being sued.
These are people that were paid substantial salaries to do a job by the taxpayer, and they didn't do that job. Not only didn't they do that job, they covered up the fact that they didn't do the job. And now the taxpayer is not entitled to know who that was, not entitled to know what action's being taken. It's absolutely unacceptable, and clearly we should know.
What we do know is these failings only came to light today thanks to a whistleblower.
I would like to say I think I should have been listened to.
She sits on the board of the regulator itself.
Because I had no choice but to make a whistleblowing disclosure, I have been subjected to the most appalling treatment. That in itself should shame the organisation.
Just as worrying, she says, was the regulator's decision in 2010 to declare this hospital safe, despite a series of troubling deaths. A year on, the trust had the highest mortality rate in the country, and 2 more babies died, including Kelly Hines' young daughter, Amelia. She said,
"I can't believe that so many people knew so many things were wrong at Furness General Hospital, and for so long before Amelia's birth in April 2011. Maybe if they'd done something, Amelia would not have died. That is a very hard thing to live with."
The regulator says those responsible have moved on. The Health Secretary said they'd failed in their fundamental duty.
Most of the facts are not in dispute. All of them are unacceptable. They have compounded the grief of the Titcombe family and many others.
But those families fear worse revelations to come from a system, they say, which puts reputations first and leaves patients like Joshua behind.
Kieran Jenkins reporting. Well, the Care Quality Commission, the health regulator, was set up to expose problems in hospitals and care homes. But as you heard in that report, when whistleblower Kay Sheldon raised issues about neglect in hospitals and the massive shortcomings of the regulator itself that she worked for, it all fell on deaf ears. So who is actually accountable? Cynthia Bauer was the chief executive at the time of this and the Mid-Staffordshire scandals. She resigned in February last year with a reported £1.3 million pension pot. Dame Jo Williams, the chairman of the organisation, resigned last September after she questioned the whistleblower's mental health. The CQC is answerable to the Secretary of State and to Parliament, so Kay Sheldon then went to the Department of Health and also raised her concerns with the Health Secretary at the time. Today, Jeremy Hunt, the Health Secretary, said he wanted to create a culture of openness in the health service.
With respect to whether anyone is still working in the NHS or indeed in the CQC who may have been responsible for some of the things that were so shockingly revealed today, that is what David Pryor will be looking at in his response to today's independent report, which he will be giving me within the next 2 months. And as I said in my statement, there will be full consideration of any sanctions or appropriate disciplinary procedures.